Of course, this has dealt a major blow to South Africa's vaccine rollout program, that is the cancellation of the Johnson & Johnson vaccines that will now need to be discarded. Let me bring into this conversation Fatima Hassan. She is the founder of the Health Justice Initiative. Fatima, good evening to you and thanks for your time. There was a lot of hope and expectation going into this weekend's G7 summit, especially given some of the indication from the likes of the US president and to some extent the French president around the kind of backing that there would be for the TRIPS waiver. In your view, are we any closer to equity in terms of the vaccine access today than we were on Friday before this G7 summit?
So I think not, unfortunately. You know, the outcome of the G7 meeting has really been very underwhelming. We thought that these leaders would be meeting in the middle of a pandemic, realizing the urgency, but what we've seen from them, you know, at the conclusion of the summit is just a lot of promises which fall short of what is actually needed in terms of vaccine equity. Some calculations done by the group Oxfam indicates that before the summit, they'd actually been pledging more donations, and by the end of the summit, they were actually pledging less donations of vaccine supplies. So, yeah, I don't think that the G7 meeting really helped in that respect. But what the outcome did indicate was, according to President Ramaphosa, that some of the G7 member states are now more willing to sit around the table to have a discussion about what the text of a TRIPS waiver could look like. And that is something that's taken a few months. And, you know, that is quite positive that some of the G7 member states are now willing to actually start having those negotiations and are not blocking that process any longer.
Whatever progress could be on the agenda, it could be months, if not years in the making, the kind of time that South Africa simply does not have. We need vaccines right now. By the looks of it, we simply are not going to be able to access as much as we need, at least in time, perhaps to save more lives.
Yeah, definitely. And, you know, the irony is that the G7 member states are on track to meet their vaccination targets with significant population coverage by January 2022 already, whereas us in the global south, not just here in South Africa, but many countries in the global south are going to take years because there simply aren't enough supplies. And there aren't enough supplies because these companies have not allowed other manufacturers to be able to use that knowledge and use the vaccine know-how to scale up manufacturing. And Johnson & Johnson, you know, is the clearest example of why that strategy has not worked, why you actually can't rely on the market to give you sufficient timely supplies in an uninterrupted way. And I think the case of South Africa's vaccine rollout, you know, should one day be recorded and written because it's the clearest evidence of how intellectual property has basically affected the ability of South Africa to have an efficient and, you know, well-run and uninterrupted vaccine rollout program.
Either way, we find ourselves in a situation, Fatima, where many South Africans are sitting and wondering when the likelihood that they may be vaccinated might be. It's a difficult question to kind of ask and even to put to somebody like you, but perhaps weigh up the complexity of where we are right now.
So firstly, you know, we're one of the countries that have started vaccinating too late and too slow, and there's a number of reasons for that, which includes a combination of the way in which government has managed this entire COVID-19 pandemic, but also in the way in which richer nations and pharmaceutical companies have conducted themselves in this pandemic. So our reality is that we only have two vaccines that we can use that have been approved by SAHPRA, the Pfizer vaccine and the Johnson & Johnson vaccine. Now, we've signed contracts with them which are subject to non-disclosure agreements, so we don't know the terms and conditions. But what we do know is that for Pfizer, we were supposed to have received 5.8 million vaccines by Q2, which is in 2 weeks' time, and we certainly haven't received all of those supplies. In fact, it's way below that amount. And we were supposed to have received about 2.8 million Johnson & Johnson vaccines, which obviously now has been devastatingly affected by what has happened in Baltimore and what has happened with a plant in the US, which has now had an impact on Aspen's ability to be able to use some of those batches for use in South Africa but not just for South Africa, for the AU as well. Because remember, Aspen was given a fill and finish license by Johnson & Johnson, not a full manufacturing license, but nevertheless a fill and finish license for supplies for South Africa, but also Africa. So firstly, we only have 2 vaccines in our vaccine selection program. That's, the first constraint. Secondly, we have a global supply crisis. What we do know is that 1/3 of the world's supplies have actually only gone to 10% of the world population who are residing in G7 countries. So the issue of vaccine apartheid, I think, is quite evident in relation to the supply chain system as well. And then thirdly, we've signed contracts with companies who can't meet demand. Clearly, they are drip feeding us with supplies. In some cases, they can't provide us with vaccines timelessly. And so this has meant that we're now relying on donations, on bridging stock. We have a situation where all of a sudden 300,000 vaccines are coming in, but only for teachers, not for people who are over 80 or over 70. So our entire vaccine rollout program has been distorted because of these supply constraints and intellectual property barriers and because of these patent monopolies. But the impact of that has meant that our entire prioritization agenda has had to change based on who's giving us a donation every other month.
It's a difficult situation in terms of planning and in terms of giving assurances to, let's say, even the teachers who from next month will be expected to be giving lessons in the primary sector, at least, to children every single day. So weighing up all of these difficulties and complexities, Fatima, what do we need right now in this moment to, I suppose, give us a sense of being in control of the situation once again and not necessarily being almost the victim of the circumstances, some of which have been beyond our control?
Yeah, so there's certain things that we do have control over, and there's certain things where the pharmaceutical companies have control over. So if we look at what our own government can do, I think now the first thing it could do is to ensure that there are mechanisms to enforce these contractual obligations, because we have signed contracts, we are paying for these vaccines. But secondly, if necessary, to say to these companies that clearly you can't meet the demand, clearly you can't meet supply needs, and there's a crisis in the system, we are now going to issue compulsory licenses. We are going to compel the transfer of technology to as many companies as possible that could manufacture vaccines, not just for South Africa, but for the rest of the global south. But the second thing that we could do right now is to say to Johnson & Johnson, there are stockpiles in other parts of the world. There are different types of stock that you have access to, and we need bridging stock. You owe us 2 million vaccines, and we'd like them right now because it's had a severe impact on the ability of South Africa to actually roll out a proper, meaningful vaccine program, because we were depending on those supplies. They were meant to be in the system weeks ago, and Johnson & Johnson, I think, has really let the country down. I've said this over this last weekend, and they owe us 2 million vaccine doses. So there is a way in which you can do it without compromising equity or without taking stock from other more deserving countries. But certainly there is a way in which Johnson & Johnson can immediately divert bridging stock to make up the shortfall. Because 300,000, remember, is 1% of that contract. The contract is for 32 million doses. 300,000 is nothing. It's, it's a drop in the ocean. And again, the way in which it's being done is it's distorting the prioritization that government had agreed to as part of the national vaccine program, which business was also part of, if you'll remember, because the vaccine rollout team has a number of those representatives. Unfortunately, civil society is not around that table. And so the means and the processes by which we can make contributions and engage and ask these tough questions are very limited, and more limited now that the minister has been placed on special leave.
We were already facing difficulties in terms of our ability to meet targets, at least the targets that we had set for ourselves. I think 2022 was the year being thrown around for a potential herd immunity. That looks like it's been thrown out of the window. What then are we looking at, Fatima, in terms of realistically expecting to vaccinate enough people to actually achieve some kind of herd immunity or community immunity?
Yeah, so I think you're right. I think the situation is very dire. Unless we can basically get millions of doses into the system immediately on an expeditious basis, then the idea of trying to vaccinate everybody by early 2022 in South Africa is not going to be possible. That then has an impact on the ability of the region to have regional immunity and the ability of the entire continent. So if we are facing these delays, and there are other countries in Africa that are also facing some severe supply constraints, then it means that the ability of many countries in Africa, and particularly the Global South, which is what the People's Vaccine Campaign has been saying, is that without sufficient supplies and with the slow rate of vaccination, it could take, many, many years, in some cases even more than a decade, to be able to reach population immunity. In that time, there could be resistance building to some of the vaccines that are being used. We may need booster shots. We may have variants or mutations. So, it's a really difficult situation of not understanding, I think for us, particularly from civil society, why these companies wouldn't want to bring in more manufacturers in the system, wouldn't want to share the knowledge, because it's quite a self-defeating public health strategy to only vaccinate a few countries with high levels of coverage, and then most of the people in the world don't have access to that type of vaccines and coverage. But having said that, our vaccine program is way behind a lot of other countries in Africa, and part of the reason is, yes, the way in which the companies have been dealing with the supply pipeline, but I think the other concern is that we need to really, urgently look at our vaccine selection. If you're only going to have 2 vaccines, if there's an issue with one of those suppliers, which we're currently dealing with Johnson & Johnson, then it does put the entire program at risk. There are other countries in Africa that are using multiple safe and effective vaccines. And so the issue about what SAHPRA is going to do in the next few weeks, I think, is going to be critical.
Fatima Hassan is with the Health Justice Initiative. Thanks for your time tonight, Fatima.